To debride a simple ulcer, the only instruments you will need are a gallipot, a scalpel, a probe, thumb forceps and mosquito forceps. You will also need surgical spirit, saline, cotton gauze swabs and cotton gauze dressings. Clean the patient's foot or hand before debridement. To do this, soak a swab with surgical spirit and clean the skin using strokes away from the ulcer site. When the general area is clean, take another swab soaked in surgical spirit and clean the actual ulcer site. Clean carefully and thoroughly. Take particular care to clean between the toes. When starting to debride an ulcer, first cut away all the overhanging skin and any other dead tissue. This is important because such tissue makes an environment that encourages organisms that infect wounds and can lead to sepsis. Another reason to cut away such tissue is because, if it is left, the wound will take much longer to heal. The body does have its own way of removing dead tissue, but it takes time. And remember that whilst this tissue overhangs the wound, it will trap dirt which could lead to infection. Sometimes it is necessary to use forceps to hold flaps of tissue. Be careful if you use forceps. Do not pull the tissue too tightly, because if you do, you may cut into good, healthy tissue. Always try to avoid cutting into tissue that is not already damaged and does have a blood supply. From time to time, clean the wound with a swab soaked in saline, or if you have no saline, clean water will do. This will help to reveal hidden pockets of skin, whilst also ridding the wound of debris. Also remember to trim away any callus or any unhealthy tissue you might find surrounding the ulcer. Finally, take a probe and gently examine the wound to make sure that the ulcer has not begun to track to deeper tissues. Use only very light pressure when using a probe, otherwise you will risk damaging healthy tissue. When you are satisfied that there are no complications, cover the wound with a gauze dressing soaked in saline and discuss self-care with the patient.